Is that the one your professor used? That's the one I use. For the specimen, I use this one. I don't use the plastinated one, I'm gonna be using this one. So at the tip there is the glans penis. This is the shaft. I don't get involved and point out the corpora spongiosum. You kind of can see it, you kind of can't. It did get separated, but I don't do it. What's this on top? That is the urinary bladder. So what's right below the number 7 here? That pin is in what's right below the urinary bladder. That is the prostate. Below the urinary bladder is the prostate. There is the right testes, right spermatocord. Boy, this is hard to see, but there it is, the vas deferens on the right. Joining the vas deferens on the right over here, that is the seminal vesicle. That's very hard to see on this picture. Over here, the left testes, look at that, all of this has been removed. That is not skin. This is tunica vaginalis. Okay, this is tunica vaginalis. And now we can actually see the testes, and we also can see the epididymis. This is very nice to see the epididymis. And just about every professor points to that because it's kind of cool. Spermatocord on the left. You should know that this is left. Left vas deferens, joining the left vas deferens right there. Seminal vesicle on the left. This is all going in another way. We could do prostate. Stick a pin in it that way. That it goes into the prostate from behind. And that's the specimen. 3 questions on this. Notice what we can't do. It's not cut open. So we can't do all 3 regions of the urethra, like prostatic urethra, membranous urethra, penile urethra. No, we can't do that. What else can't we do? We can't do the Cooper's gland or bulbal urethral gland. Actually, it is in there, by the way. It's just very hard to see because it's so tiny. But if we pick this thing up and turn it over, I'd be able to show it to you. And that would be Cooper's gland. But we can't do that. So we can't do anything that's inside. These are kind of cool, but we don't put that on the test because this is reproductive. So these are the kidneys. This is inferior vena cava, by the way, a small piece of the inferior vena cava. And that means these what? These are the blood vessels. These are spermatic artery and veins. That makes this one what? That is the urethra. I mean, ureter. Get it right. Oh, that's why you correct yourself, by the way. Sometimes you say something stupid. So there's the kidney. The tube coming out of the kidney is the ureter. And this is entering the urinary bladder. And what you would have noticed if you really observed this in class is that this loops around the ureter. And that's because of the way these things descended. These things first initially formed in the embryo and the fetus all the way up exactly the same spot position where the ovaries are in the female. The exact same cells that became ovaries in the female are the same cells that become testes in the male. How did it know what to do? They're chromosomes. Males are XY and females are XX. If when this all came together, it became XX, then those cells became ovaries. If it's XY, then those same exact cells became testes, and then they move, they migrate. And some baby boys, when they're born, these things are knocked down in the scrotum where they belong. Cryptorchidism, that's what that's called. And that's why one of the first things that a baby boy is born, what you'll see the doctor do, they kind of, feel the scrotum. And in initial exams on little boy children, they make sure the testes have descended to make sure it didn't get missed. It's not an easy fix, by the way. Not always advised to fix that. This is the plastinated specimen. Check with your professors to see if he's going to use this. I don't, because the structures got a little bit distorted. Epididymis looks kind of weird to me, and so on. But it's cool. But these are real, by the way. These are all. There's a person that walked on this planet. That's their reproductive organs. In the cat. This is what we tend to stick with. In my class, I tell them, if you remember 5 things on this, and 3 of them are on the test. If you remember 5 things on this, you got it. You got all 3 questions. So you got here, that's the skin sac, so that's the scrotum. So we got number 1, right or left scrotum. And number 2, right or left testes. Number 3, off the testes, spermatocord, right or left spermatocord. Number 4, inside the body, this guy, that little thing in there, all the way in there, right or left vas deferens. And number 5, the penis, that's it. If you know that, you're probably going to get every question right. I've never seen any professor point to the prostate on the cat. It's there. It's very tiny, right here, somewhere up there. As a matter of fact, you could feel it more than you could see it. They point to it here. And this is something else that I guarantee you're going to see it this way. We take the testes out of the scrotum and we put it on their thigh, their leg, their hind leg. They don't have a leg or a thigh, but we put it up there. And that's for you. That's to make it easy to see. The difference between spermatocord and vas deferens. The spermatocord, number 1, is thicker and bigger, and this vas is very skinny. But more importantly, this is outside the pelvis. This is inside the pelvis. Yes?
I've seen this image with some of my students. Can you show which one is the left versus the right testes? Because since this is the same part as the penis.
Yes, now unfortunately, there is the right, and the left one would have been way down here, and it's off the screen, so I
But we
can't.
labeled 1, 2, and 3 as scrotum testes and epididymis. That's why I'm wondering, is that the testes or is that?
No, one is the scrotum, 2 is actually the glans penis, and 3 is actually the foreskin.
So 1 is the scrotum for 4, 5, and 6.
Yeah, testes is 4. 5 is actually the epididymis. 6 is actually the pampiniform plexus. So all of the, notice the cat has everything that the human has, but we don't test on that. Number 1, it's kind of small. And number 2, this happens to be a pristine specimen. None of our cats, when we opened up, look this good. This probably is a really freshly killed cat. Our cats have been hanging around in the bags for a couple of years before we even get to open them. They probably are hanging in a lab somewhere before we even get them shipped to us. So, you know, they're old. Things aren't quite this fresh looking. So we don't do epididymis or pampiniform plexus on the cats. We're confident you're getting tested on that on the human. So if you know it on the human, it shouldn't be that much of a leap to get it on the cat. And this is an undergraduate class after all. If you want to get that, you go to veterinary school, and then you'll get the details of that. Yeah, so this particular cat, I mean, that is pretty cool that you can actually see the foreskin on that, right? But that's it. That's what that is. That's the prepuce, or the foreskin. That's the glans. So you can't see left.
15 would be the prostate?
Huh?
15 would be the prostate?
14.
Oh, we're right there.
Yeah. 15 is the crux, or the crust, the base. This is where you'll find bubble urethral gland.
Oh,
Oh,
now
yeah.
you're not talking about it.
Yeah. That's the base of the penis. On the female,